Before starting the session, what I want a brief introduction. I want you to give a brief introduction about the platform of Unacademy. So yes, I have got 8 years of teaching experience. For the past 8 years, I am teaching the NEET PG aspirants, FMG aspirants and the UG students, first year MBBS students. This is my referral code which can be used by you if you want to be the part of free sessions on the Unacademy platform. And this will be highly useful for you. Now, the free sessions can be unlocked by using the code NAT10, and many free sessions always I take on the platform of Unacademy, so you can join me. I also want to tell, this is the Telegram group of mine, that is Monalisa Anatomy, and you can join Monalisa Anatomy to get the link of all my free and plus classes, and also you can ask anatomy related doubts in my group. Now, limited time offer. When we talk about limited time offer, this is the limited time offer for the discounted rate of Iconic subscription. So, you can be the part of this Iconic subscription, and this is a highly discounted rate, and another 10% discount you can avail by using my code NAT10. Download the Unacademy app. So, if we talk about the app, this is the download the Unacademy app, and thereafter find your goal as NEET PG, and thereafter use your code NAT10 for getting additional 10% discount. Additional 10% discount. Now, I want to tell you about the benefits of plus subscription. So, when we are talking about the plus subscription, there are certain benefits. You can be the part of daily live sessions, okay. So, daily live sessions and the courses which are going in a very structured pattern. Either you want to target your NEET PG exam, either you want to target your INICT FMG entrance exam, or you want to target your prof exam, university exam. So, you can be the part of any structured courses. Thereafter, you can be the part of live test and quizzes. Unlimited access is there. So, unlimited times you can view the session if you have missed out any of the session. Also, what is important on the Plus platform, every 4th session is a doubt clearing session. You will get PDF of the notes and also a number of educators for one single subject. So, you can follow any of the educators, and if you like the session, you can follow me on the Unacademy platform. This is the code NAT10 which can be used by you for getting additional 10% discount. So, there is also test going on the always on the platform of Unacademy. Mentorship is there. The educators of Unacademy will help you to target your course and target your dream rank in your entrance examination. Now, what are the benefits of Iconic subscription? The benefits of Iconic subscription is, along with the plus subscription, other benefits which is added on with the Iconic subscription is, you can be the part of video lectures, QBank rapid revision course, and also QBank 3, and you will get printed notes in case of Iconic subscription. Printed notes will be provided to you. Now, either you can be the part of NEET PG Iconic, or you can be the part of plus subscription. This is the discounted rate, and the comparison of the rates and the cost of both plus and the Iconic subscription has been done here, and these are the codes which can be used for additional 10% discount. Now, 4-year subscription, if we talk about 4-year subscription, so 4-year subscription is the new thing which is added on the platform of Unacademy, and this is highly beneficial for the students of 1st or 2nd year because their prof examination and along with their preparation. So, university examination of 1st year, 3rd year will be done along with the preparation of their next examination. So, it is highly beneficial that at one time only you have to pay 60,000. And you can avail the opportunity of being the part of free all live sessions, being the part of all courses which is going on the platform of Plus, being the part of Iconic is for 4 years is just costing 75,000. Avail this opportunity by using the code NAT10 and getting additional 10% discount. Now, launching some of the new subscriptions on for this month is one already launched. You can be the part, so you can just take 2 months of subscription and have the benefit of a quick revision of all 19 subjects taken by the top educators of Unacademy platform. Also, amazing preparation, medical PG preparation can be done by taking 12 months of subscription, and additional 2 months is absolutely free to you. Professional 3rd year batch. So, when we are talking about professional 3rd year batch, the batch starts from 21st July, which here this batch is of 6 months, and the course which will completed is 1st year subject, 2nd year subject and 3rd year. Why I am targeting on this batch? Because whole of the anatomy will be taken by me, and this will be highly useful for the students who are in 2nd year, want to revise entire anatomy, or 3rd year want to revise entire anatomy. So along with that also it will be useful for university going examination, means first prof students. So biochemistry by Dr. Karthikeyan and physiology will be by the top educators of Unacademy platform, along with me taking anatomy. So all the students, not only of first year but also of second and third year, take the subscription, be the part of the session starting from tomorrow. 8:30 p.m. is the first session timing. I am taking the first session starting from anatomy, so do join and avail the opportunity of clearing your university exam along with your next preparation. Last mile NEET PG revision batch. So this batch is starting on 16th July. Be the part of these sessions. The entire course is of 2 months. Integrated clinical batches with all the faculties, many of the faculties taking the integrated batch course. Clinical integration has been done so that clinical questions can be solved, which is highly important for the upcoming examination. Integrated clinical NEET batch 2021. Focus FMG batch and target next 22 batch. So these are the batches which is simultaneously going on the platform of Unacademy. Do join this. This is highly useful. Let's start with the first MCQ of today's session. All the best to everyone. So let me read this MCQ. A young athlete person presents to your office after sustaining an injury to the right upper extremity. Physical examination reveals weak right forearm flexion and absence of biceps reflex. Given these findings, sensation loss in which of the following areas is most likely to be found in the patient? So the options are posterior arm, posterior forearm, lateral forearm, medial forearm, or thenar eminences. 5 options are. Please mark the correct answer. Five options are there. Please mark the correct answer. Your time begins now. All the best. Then I will come up with the explanation of this MCQ. So waiting for your answers and then I will explain this MCQ. The key points you have to mention. So the key points will target you in approaching to the right answer. Weak flexion of forearm, absence of biceps reflex. Loss of sensation in which of the area will be present in the patient. So weak right forearm flexion and absence biceps reflex. So Sam is telling C, Education India is telling A, Aditya Singh is telling C. What about others? Harini is also telling C. So yes students, the correct answer here is, actually the correct answer is also lateral forearm. Okay, so many of the students is telling lateral forearm and lateral forearm is absolutely correct. So in this clinical MCQ, injury of the patient and what is mentioned for the key point is loss of weak right forearm flexion and absence of biceps reflex. Actually the nerve. Okay, Aditya Singh is giving the explanation. Yes, so that is the reason why it is the correct answer. The patient has symptoms which is very much suggestive of musculocutaneous nerve. Okay, because the flexor group of muscle is not working. Also, if we know that musculocutaneous nerve is injured, so only the lateral aspect of the forearm, we know that musculocutaneous nerve again becomes the lateral cutaneous nerve of forearm and continues as becoming lateral cutaneous nerve of forearm. So that is the correct answer. The musculocutaneous nerve innervates upper arm of flexor, biceps brachii, coracobrachialis and brachialis muscle, and after innervating these muscles, the remaining fiber will continue as becoming lateral cutaneous nerve of forearm, innervating skin on the lateral aspect of forearm. So many of you have already given the right answer. Very good. And so this was how we are approaching to the right answer, but some of the incorrect options. Why it is incorrect? Why can't posterior forearm with the right answer? Because the cutaneous sensation of posterior arm is given by which nerve? It is given by the branch of radial nerve. By posterior cutaneous nerve of arm is a branch of radial nerve. Posterior forearm, also posterior forearm cutaneous innervation is the innervation provided by the radial nerve. Medial forearm is getting innervation by a branch of ulnar nerve. Medial cutaneous nerve of forearm is again a branch of ulnar nerve, not musculocutaneous. Thenar eminences. So if we talk about the thenar eminence, actually its innervation is done by median nerve. Yes, Aditya Singh, absolutely right. So median nerve will a recurrent branch of median nerve is providing innervation. So this is the reason thenar eminence is not the correct answer. Shruti, good evening dear Shruti. Shri, good evening. Welcome to the session dear Shruti. Let's start with the second MCQ. Okay. Brachial cyst arises due to failure of obliteration of second brachial cleft, persistence of urachus, thymus or thyroglossal tract. So, which according to you is the correct answer? Question number 2. Question number 2, mark the correct answer. Harini is telling A, what about others? It's a direct MCQ only. It's a quite commonly seen as a, it's quite common seen. So, I will show you the location also. Let me wait for your answer. Branchial cyst arises due to which of the following? Persistence of urachus, thymus, thyroglossal tract, failure of obliteration of second branchial cleft. So, yes, Harini has given A answer. I am waiting for the others to give the answer. Shiny is telling A. What about others? Yes, the correct answer is also A. Okay, failure of obliteration of second branchial cleft is the correct answer. Yes, so Shri is also telling A. Actually, a branchial cyst is a congenital cyst, epithelial cyst, and the location is it is located in the neck region and very close to anterior to sternocleidomastoid muscle. It is actually the reason of formation of branchial cyst is the failure of obliteration of second branchial cleft during the embryological development. So, it get buried at times. It is the remnant of this second branchial cleft is remaining. It has not been fully degenerated and ultimately it leads to a cystic swelling. Okay. So, cyst usually, yes, absolutely right there. Okay. Cyst usually persists as a smooth, slow growing, enlarging neck mass which will increase along with the upper other respiratory tract of infection. I would like to show you this diagram where you can see branchial cleft, this swelling, and ultimate location is onto the anterior. It is located in the neck region anterior to sternocleidomastoid muscle. No, C not directly the answer. Thymus, no dear, not thymus. And NBR, it's clearly the second branchial cleft cyst. Okay, let's move on to the third. Abduction of thigh is limited by which of the following structures? Abduction, limiting the abduction movement in thigh is done by which of the following? Whether it is tension in the adductors muscle, tension in the adductors and iliofemoral ligament, tension in adductors and pubofemoral ligament, tension in adductors and ischiofemoral ligament. So, according to you, which is the correct answer? Question number 3. Entertainment is telling B. Okay, Aditya Singh is telling it's C, D. Okay, D. Abduction of thigh is limited by, so D. Aditya Singh is telling option D. Entertainment is telling B, and Vimal is telling D. What about others? Abduction of thigh is limited by. Anyone else wants to give the answer? So, yes, let me explain then. No one else wants to give the answer. So, yes, the correct answer is, Harini is telling C. Okay, Harini, yeah. So, actually the correct answer is, anyone else? Okay, the correct answer is C only. Actually, there is no doubt about adduction. When we are talking about abduction, so adductors will be surely involved. So, all the option is containing adductors. But if we talk about the ligaments of hip joint, it's the iliofemoral ligament which is limiting the abduction. It's the iliofemoral ligament. It's the iliofemoral ligament which is also limiting the abduction. It's the iliofemoral ligament which is also limiting the abduction movement. Okay. Okay. So, it is not only the tension of adductors but also iliofemoral ligament which is okay, pubofemoral, see, don't, so I just iliofemoral, no, it's a just slip of tongue dear, pubofemoral ligament. So, can anybody tell me it is preventing, when we talk about iliofemoral ligament is preventing backward fall of hip, backward fall of hip while standing. While standing. Got it, dear? So please, I mean to tell, C option is correct. Pubofemoral. Iliofemoral ligament is preventing the backward fall. Can anybody tell me iliofemoral ligament correct name? One more name is there, iliofemoral ligament. What is the name of iliofemoral ligament? It is also called as, yes, Aditya Singh, backward fall. It's written here. I have written there. Iliofemoral ligament prevents backward fall while standing. But when we talk about pubofemoral is causing limiting abduction. What about ischiofemoral? So earlier ischiofemoral was also given as an answer by many of the students. Ischiofemoral is limiting which movement? Can anybody tell me? It is limiting internal rotation of hip. Please mark it. Pubofemoral ligament is limiting abduction. Ischiofemoral ligament is limiting the internal rotation of hip, and iliofemoral ligament is also called as bigeloy ligament. So all of you, those who have written D as the option earlier, if we talk about ischiofemoral, it is forming limitation of medial rotation or internal rotation of the hip. Internal rotation of the hip. So all these ligaments done. So here you can see the 3 ligaments which is highlighted here. The strongest one is, yes, Aditya Singh, absolutely right. I asked this question and you are absolutely right. Iliofemoral ligament called as bigeloy ligament, strongest ligament of body preventing the backward fall. Ischiofemoral ligament is lying posteriorly and limiting internal rotation. Pubofemoral ligament is limiting abduction movement of the hip. Let's move on to the next MCQ, that is MCQ number 4. Which of the following is true about the upper 1/3 of the rectum? So I am talking about in this MCQ, they have the MCQ is targeted about the point of attachment of peritoneum area. So according to you, which is the correct answer? Which of the following is true about upper 1/3 of the rectum, peritoneum covering? It is covered by peritoneum only anteriorly. It is covered by the peritoneum on the front and the sides and the back. It has no peritoneal attachment. It is covered by the peritoneum on the sides and anteriorly. On the sides and anteriorly. So question number 4, 4 options are there. Okay, C and D, no peritoneal attachment. So upper 1/3, dear. So please mark this point which I want you to pay attention. Upper 1/3 of the rectum. So upper 1/3 of the rectum. So this is important for you to know that I am asking about upper part. Yes, Aditya, upper part is covered by peritoneum. So upper part is having a peritoneum covering. Now that is the hint I provided. Now tell me on which area it is having upper part of the rectum covered by peritoneum. So yes, mixed bundle of answers are coming. Sides and anteriorly. Vimal is telling sides and anteriorly. What about others? What about others? It is covered by peritoneum on sides and anteriorly is absolutely correct. Vimal, you are absolutely correct. Let me show you a diagram. First thing is that this is the showing the covering. Everyone can appreciate this diagram. Anteriorly you can see in the upper aspect it is having the peritoneum covering as anteriorly, and the posterior aspect is non-peritoneal. Posterior aspect is non-peritoneal as shown in the diagram. I also want to show you a better picture which will help you to understand the entire areas divided into 3 parts and the covering. See here. So see here this diagram, this is very useful for you to understand. Area covered by peritoneum in case of rectum. So upper 1/3 is covered by the peritoneum not only anteriorly but also onto the sides. Can you see here? This is the whole covering, not only anteriorly but also onto the side. Lower part is non-peritoneal, no peritoneum covering, and middle part is having slight on the anterior aspect only. So it was asking about upper 1/3. So if we talk about upper 1/3, it is covered by the peritoneum onto the sides and onto the anterior aspect. Lower part is not having any peritoneum covering, and anteriorly middle part is having slight peritoneum covering. Let's move on to question number 5. Identify the artery marked in this cadaveric image. Identify the artery marked in this cadaveric image. Which artery is this? Everyone, which artery is this? The red color. The red color highlighted artery, which artery is this? Whether it is middle cerebral, the basilar, the vertebral or internal carotid. Identify the artery in this cadaveric image. Basal aspect of the brain has been shown. Inferior view of the brain. Vertebral artery and lying here. Okay, what about others? Middle cerebral artery. Okay, what about others? Sam is telling D, internal carotid artery. Harini is telling A. Harini is telling A. Okay, mixed bundle of answers are coming up. Mixed bundle of answers are coming up. Nath is telling A. Okay. D. Okay. Janani is telling A. Okay, got it everyone. Let's see the correct answer. Actually, the correct answer is who have given the right answer. Let me see who have given the right answer. Question number 5th, Vimal is telling D. Okay. And so 5th, yes, it's internal carotid artery is the correct answer. Those who have given internal carotid artery are perfectly right. So the correct answer is internal carotid artery. Let me show you the inferior aspect or the basal aspect of the brain. Okay, question number 5th. So let me slightly highlight this diagram. So everyone, can you see the enlarged view? I would like to explain you. Okay. So here what you can see here, this are the two arteries on either side. Can you see here? This is the two arteries on either side. Okay. These are the two arteries on either side which is joining to form okay. So what you can see, this is basilar artery, this is basilar artery, and these two are, this is basilar artery and these two are vertebral artery. These two are vertebral artery and this is the basilar artery. Got it? Basilar artery and the vertebral artery. Now, here the two side vertebral artery joins to form basilar artery. Now, this two arteries again you are seeing here, two on either side, one side this and this. So here this will be PCA, posterior cerebral artery, and this artery which you are seeing is superior cerebellar artery. Superior cerebellar artery. This is superior cerebellar artery. Got it? Superior cerebellar artery. Now what else you can see? When you will see this artery is ICA, internal carotid artery, and internal carotid artery branch which is going laterally, as you can see in the diagram. It is traversing laterally. This is MCA, middle cerebral artery. This is middle cerebral artery, which is going towards the lateral sulcus, and this two arteries going anteriorly is ACA, anterior cerebral artery, and the connecting link between which these two, here the connecting link between these two, this artery is called anterior communicating artery. This is anterior communicating artery. This artery is anterior communicating artery. So everyone, the important arteries, can everyone appreciate important arteries? The two side vertebral artery joins to form the basilar artery lying on the basilar sulcus. Then it diverges to form posterior cerebral ends and then superior cerebellar artery. Okay. Here the circle of Willis, you can see it's not formed by MCA, that is middle cerebral artery, anterior communicating artery, and this is ICA. So is it clear to everyone all the arteries in this cadaveric image? Can everyone appreciate that? Everyone can appreciate the important arteries which can be very nicely appreciated. Smaller, more arteries are there, but very importantly, very nicely we can see the other arteries. Okay, let's move on to the next MCQ now. Which of the following nuclei not belong to the general, which of the following nuclei is not belonging to the general visceral efferent group? General visceral efferent, which of the following is not belonging to general visceral efferent except, okay, please mark the correct answer for question number 6. All of the following nuclei belong to general visceral efferent except, which is not belonging to this category, whether it is Edinger-Westphal nucleus, lacrymatory nucleus, the dorsal nucleus of vagus, or the nucleus of tractus solitarius. Nucleus of tractus solitarius. So, according to you, which is the correct one? Shweta Verma is telling it's B, lacrymatory nucleus. What about others? What about others? So, give the correct answer, then I will come up with the explanation. Got it, everyone? Sam is telling D, nucleus of tractus solitarius. What about others? Can I come with the, so I think no one else is giving the answer, so I would only give the answer now. Actually, the correct answer is given by, Vimal is also telling A, Avinash is telling A, Sam is telling D. What is the correct answer? Okay, if I tell it's the correct, so I am getting a mixed bundle of answer B, C. So everyone is confused. Everyone do revise all the functional columns and nuclei. If you want, I will take a session for it. Okay, I think this topic is not clear to students, so I will certainly take a session for it on the YouTube Let's Crack NEET PG channel पे इस पे एक session लेंगे. Actually the correct answer is given by Sam, that is nucleus of tractus solitarius. So when we talk about tractus solitarius, it is carrying afferent. It is carrying afferent fibers. It is the nucleus of general visceral afferent and special visceral afferent. Taste sensation. So actually two functional component. One is general visceral afferent and special visceral afferent. So general visceral afferent and special visceral afferent, both these functional component is having only one nuclei belonging to it, and the name of the nuclei is nucleus of tractus solitarius. When we talk about the other nuclei, that is Edinger-Westphal nucleus, lacrymatory nucleus or dorsal nucleus of vagus, they are belonging to parasympathetic efferent. They are carrying preganglionic parasympathetic efferent fibers. Parasympathetic efferent fibers. Parasympathetic efferent fibers. Got it, everyone? So they are carrying parasympathetic efferent fibers, Edinger-Westphal nucleus, lacrymatory nucleus and dorsal nucleus of vagus. Only nucleus of tractus solitarius is afferent. It's carrying the afferent. Other than that, we have got two more nucleus, that is superior salivatory nucleus, inferior salivatory nucleus. So also superior, inferior salivatory nucleus. So we have got 5 nucleus category in case of the general visceral efferent. General visceral efferent. So what does general visceral efferent fibers carry? Preganglionic parasympathetic efferents. Got it, everyone? So we will have a session in detail. I will explain you about all the nuclei and the functional column and the component. Don't worry about it. Question number 7. Which is best describing, easy one, which is best describing the action of pectoralis minor muscle, the muscle which is covered by clavipectoral fascia. Clavipectoral fascia, can anybody tell me, it is covering 2 muscles, which are they? One is pectoralis minor. What is the other muscle covered by clavipectoral fascia? So you just tell me about the action of pectoralis minor muscle, whether it is stabilizing the scapula by drawing it inferiorly, anteriorly against the thoracic wall, adducts and medially rotates the humerus, anchors and depresses the clavicle, rotates the scapula. According to you, which is the correct one? A, B, C, D. Absolutely right, Aditya Singh. Absolutely right. Now give me the answer of this MCQ. So yes, I am getting Sam B. Sam is telling B, adducts and medially rotates. Pectoralis minor hai ye, pectoralis minor dear. Pooja is telling B I am getting Dawn is telling B, Shweta Burma is telling A, and roll number 140 is telling A. Helps in protraction is one of it. So, most correct 4 options. I am talking about the 4 option which I have given. You have to mark the most correct among that. Raja Ram is telling A. Raja Ram is also telling A. What about others? Question number 7. Harini is telling A. So, let me explain the correct answer. Actually, the correct answer here is A. The action of pectoralis minor muscle is it stabilizes the scapula by drawing it inferiorly against the thoracic wall. So, the most correct option is A, which is describing the action. So, all of you do revise what is the action of pectoralis minor muscle. It is stabilizing the scapula by drawing it inferiorly anteriorly against the thoracic wall. So, this is the correct answer, question number A. Now, I also want to show you this diagram where the attachment of pectoralis minor muscle has been shown, the origin and insertion. So, my dear friends, what you can appreciate here, this bone is the clavicle bone, okay. This is the first rib, this is the second rib, this is the third, and this is the fourth, and this is the fifth rib. Third rib, fourth rib, and fifth rib. So, can you see at the junction of the costal cartilage and the bone rib, the origin occurs from third, fourth, and fifth rib costal cartilage junction, costochondral junction, and the insertion is on the coracoid process, and the action is action. What is the nerve supply of pectoralis minor muscle? Can anybody tell me what is the nerve supply of pectoralis minor muscle? Nerve supply, it's from pectoral nerve, lateral and medial pectoral nerve, branch of both medial and lateral cord of brachial plexus, okay. And it is stabilizing the major, yes, it helps in protraction also, but it stabilizes the scapula also. Yes, absolutely right, Aditya Singh. Okay, good one. Let's move on to the next MCQ. Okay, parasympathetic fibers from absolutely right, Saini. Rajaram, absolutely right. So, parasympathetic fibers from 9th cranial nerve synapses in which of the ganglion before traversing to parotid gland. So, before reaching the parotid gland, parasympathetic fibers from the 9th cranial nerve synapses in the ganglion before traversing to the parotid gland, whether it is otic, whether it is ciliary, submandibular, or pterygopalatine. Pterygopalatine. So, A, many of the students are telling A as the correct answer. So, many students are telling Harini, and many students are telling A as the correct answer. Got it everyone? Question number 8. Okay, most of the students are has given the right answer, and the correct answer is otic ganglion. Absolutely right. Otic ganglion is the ganglion of through which the preganglionic parasympathetic fibers of the 9th cranial nerve synapses there means relays theirs, and then the postganglionic fibers will traverse and give innervation. Secretomotor fibers reaches to the parotid gland. Absolutely right. So, this is a diagram in which the 3 pathways has been shown: parasympathetic, sympathetic, and sensory. Okay. So, what you can see, the sensory fibers are getting was toward auriculotemporal nerve, and we can see green color is for parasympathetic fibers. The fibers arises from inferior salivary nucleus, which is lying in the pons, and from here glossopharyngeal nerve arises. Through tympanic branch, tympanic plexus are formed, and ultimately this is relaying in the otic ganglion, and thereafter it is giving innervation to parotid gland. So, all the 3 pathways are there. So, by seeing this diagram, you can revise sympathetic, parasympathetic, and sensory pathway which is traversing and giving innervation to parotid gland. I have also used a flow chart for describing the secretomotor fiber pathway or parasympathetic fiber pathway. So, you can just see here the Preganglionic parasympathetic fibers are arising from inferior salivary nucleus in pons. So this nucleus is also belonging to general visceral efferent column, functional column, general visceral efferent. From here preganglionic fibers arises anthroglosopharyngeal nerve, tympanic branch forming tympanic plexus. Ultimately this fibers will relay into the aortic ganglion. This was asked in the MCQ. Okay, so this is the correct answer. And from here postganglionic fibers arises and they via auriculotemporal nerve, it will supply the parotid gland. It will give innervation to parotid gland. It will give innervation to parotid gland. Got it everyone? Parotid gland. Got? Done. Let's move on to the next. Question number 9. So, which muscle is correctly matched with the accompanying description? So, which muscle is correctly matched with the accompanying description? Lumbrical first and second is bipinnate. Lumbricals third and fourth is unipinnate. Dorsal interossei is bipinnate, deltoid is bipinnate. So, according to you, which is the correct answer? 4 pairing is given here. You have to say, you have to mark the most correct one. Which muscle is correctly matched with the accompanying description? First, second lumbrical is bipinnate, third, fourth is uni, dorsal is bipinnate or deltoid is bipinnate. So, your time begins now. Mark the correct answer. All of you can mark the correct answer. Raja Ram is telling C and Ram is telling, Kalpesh Ram is telling C. What about others? What about others? Question number 9. Dawn is telling C, Shweta Verma is telling C and Aditya Singh. Okay, what a great, okay, very nice. So, everyone knows this. Okay, maybe a revision kind of MCQ. Good one, very good. So, all of you are right. Dorsal interossei is bipinnate, absolutely right. So, let me show you a diagram for it. So, all of you are absolutely right. See here, what I am showing you here in this diagram is the lumbrical muscles. Okay, so this is first, this is second, this is third and fourth lumbrical muscle, the muscle which is lying in between the metacarpals. So, you can see the shape is like half pinnate, but when you see the shape of third and fourth lumbrical, it is unipinnate. It is third and fourth is bipinnate. So, see here, third and fourth lumbrical is bipinnate. So, very nicely we can revise it also. And unipinnate is the first and second lumbricals are unipinnate as shown in the diagram. Okay. Multipinnate acromial, Aditya Singh. Now, see here palmar interossei. When you see the palmar interossei muscle, see here the palmar interossei muscle, when you are seeing, it is again unipinnate. You can absolutely see it is a unipinnate muscle. Okay. When I will show you dorsal interossei, now see here, this is a diagram showing dorsal aspect. So, it is showing dorsal interossei muscle from the dorsal aspect, and the dorsal interossei muscle, all the dorsal interossei muscles are bipinnate. Very nice diagram for your understanding. All dorsal, all the dorsal interossei are bipinnate. Now, see here dorsal interossei. Can you see all the 4 dorsal interossei are bipinnate. Now, I want to show you a diagram where you can appreciate the fibers of deltoid muscle. The acromial fibers are multipinnate. See here. So, the muscle which is shown is the deltoid muscle. Actually, to give you the best answer, it's only the middle or acromial fiber. It's only the middle and that of acromial fibers of deltoid which is multipinnate, So, everyone can appreciate this. Can you see here? Many, I would like to use different color. Okay. So, very nicely you can see here multiple feathers are there, multiple feathers. Very nicely you can see multiple feathers are there in the deltoid middle fibers. So, it is multipinnate. Is it clearly seen multipinnate. Deltoid acromial fibers are multipinnate. When we talk about the anterior posterior fibers, they are just unipinnate, not multipinnate. Now question number 10. Which of the following muscle produces intorsion of eyeball? Which of the following muscle produces intorsion of eyeball? Whether it is superior rectus and superior oblique, inferior rectus and inferior oblique, inferior rectus and superior oblique, superior rectus and inferior oblique. So which of this combination is the correct answer? Which of the following muscle is producing and causing intorsion of the eyeball? Which pair is perfectly correct? Which of the following muscle produces intorsion of eyeball? So yes, Nath is telling A, Vimal is telling D. So mixed answers are coming up. Harini is telling A. Harini is telling A. Vimal is telling D. Nath is telling A. Vimal is telling now C. Sam is telling D. So yes, that means I have to revise the action of extraocular muscles. Extraocular muscles action should be revised. Actually, the correct answer is D. Again, Khatri is telling D. The correct answer is A, superior rectus and superior oblique. Okay, so let me revise the action of extraocular muscles, because this is also very important for you to know. The first thing which I want to show that we have got 7 extraocular muscles. We have got 7 extraocular muscles. Okay, 7 extraocular muscles. So this 7 extraocular muscles are, we have got a group of 7 extraocular muscle, that is levator palpebral superioris. We have got superior rectus, superior oblique, inferior rectus, inferior oblique, medial rectus, lateral rectus, and we have also got the oblique, superior and inferior oblique. So altogether we have got 7, and we have to know the individual action of each muscle. The first thing which I want to tell that the action of extraocular muscle occurs in 3 plane. When we talk about elevation and depression, it is occurring in the transverse axis. When we talk about adduction and abduction, it is occurring in vertical axis. When we talk about intorsion and extorsion, what do you mean by intorsion? Moving the eyeball internally and rotating it outward, it is extorsion. The action of external internal rotation or intorsion and extorsion is occurring along antero-posterior axis. So 3 axes of movement: antero-posterior, the perpendicular axis and the transverse axis. What is important is to know the action of each individual muscle. So please, so I would like to write this. Okay, so all of you please note down this. This is important, and those who are slightly confused, write down action of extraocular muscles. Action of extraocular muscles. Now, when actually firstly superior oblique and inferior oblique, note down. When we talk about superior oblique and inferior oblique, so I will firstly write the name of the muscle. So 7 extraocular muscles are there. We have got 4 recti: superior rectus, inferior rectus, we have got medial rectus, and we have got lateral rectus, and we have got also LPS, levator palpebral superioris. So it is important that you should know the action of each individual muscle. So actually when we talk about the oblique muscle, it is just reverse their name. So superior oblique will cause depression of eyeball, it will cause depression of the eyeball, intorsion of the eyeball, and abduction. They are active, both oblique muscles are active in abducted eye. Inferior oblique, just reverse to its name, inferior oblique will cause elevation, will cause extorsion, and will cause abduction. Yes dear. Superior rectus, when we talk about superior rectus, it will cause elevation, but it is also causing intorsion only. Please note down, both the superior one is causing intorsion, but it is active in adducted eye, so adduction. Inferior rectus, depression according to its name, extorsion just opposite to its name, and both this are active in an adducted eye. So adduction, abduction action which I have written for superior oblique and recti, they are secondary action, not the primary action. Medial rectus, lateral rectus, according to the name, same as it name, medial rectus will cause adduction of eyeball, lateral rectus will cause abduction of eyeball, and levator palpebral superioris will cause elevation of upper eyelid, elevation of upper eyelid. Is it okay everyone? Is it okay? So I have written the action of all extraocular muscle. Please do revise, it is highly important. Very easy to remember. Oblique is just opposite to its name. Just remember that recti muscle is active when the eyeball is adducted position में रहता है. Oblique active होता है जब eyeball abducted position में होता है. Levator palpebral superioris. So levator palpebral superioris means elevation. Levator word attached है. Medial lateral rectus very easy according to its name, adduction and that of abduction. Okay, so let's move on to. So before ending this session, I would like to tell you few important points. My live free session, so actually not tomorrow, but from day after tomorrow, you can join. Basically, my live free session is almost every day, few days it's not there, but 6 p.m. session, and most of the free sessions is you can see where MCQ session is targeting. You can join me for having an interaction. Use the code NAT10 for unlocking the session and be the part of free sessions on the Unacademy platform. My dear friends, if you want the link of all my free sessions, if you want to ask me anatomy doubts, if you want to know about my plus courses and you want to take the plus subscription, any details you want to ask, doubts of anatomy, you can use my code NAT10 for 10% discount. You can use the code NAT10 for unlocking free session and join my group for asking your anatomy related doubt and getting the link of all my free session. You can follow me on the Unacademy group so that you can get updates. Unacademy app पे follow कर सकते हैं so that you can get updates of my session. Now my one of the plus subscription course is starting, so you can take the plus subscription, and this is 6-month course, beneficial for the first year students, second year students and the third year students. All the first year batch, second year batch and third year all subjects will be done. That means first year students के लिए anatomy will be covered whole by me. I will cover the entire anatomy. Physiology will be covered and biochemistry will be covered. Okay, these 3 subjects will be covered up. And again I want to tell that not only your university exam and your Viva preparation will be done, but also biochemistry is done by Karthik and Son, and also next examination you can prepare up with this session. So do join, use my code NAT10 for 10% discount. I am starting from tomorrow. The timing of my session is 8:30 p.m. Yes, Aditya Singh, I know writing session for, okay, I will sure try, Aditya Singh, yes, sure I will. Okay, 4-year subscription. 4-year subscription can be taken by you if you are interested for having your preparation right now from the university exam, for your university exam and for your Viva exam, practical in university and your next. So just go for 4-year subscription. It's highly less. Its cost is just 60,000 for plus and Iconic के लिए 75,000 per day cost. Come for after using my code and add 10 you get 10% discount, and per day cost comes about 43 rupees for the Iconic and 37 rupees for the plus subscription. I have also included this slide where you can have the comparison of rates and of NEET PG plus subscription and Iconic subscription. So you can just go through it, and whichever suits you, you can be the part of, you can take that subscription, use my code and add 10 for 10% discount. All the best. We will again meet with upcoming session. Thank you so much. So I will update you about my upcoming session. 6 p.m. is my special class के session. Generally 6 p.m. में होता है. Saturdays को और Sundays I take more session. All the best. Thank you so much. Sure Aditya Singh. Sure Aditya Singh. Thank you. Sure, I will take a session and make a video on writing techniques for the first year university exam. Thank you. Thank you, students.